So this is the basic common anatomy. So this basic structure is the femur, the articular cartilage, the medial collateral ligament, medial meniscus. Always remember the lateral meniscus. Medial meniscus is comparatively thicker compared to the lateral meniscus, and it works as a shock absorber during the walking or the weight bearing time. And then comes the lateral collateral ligament, tibia being an important bone all around. So there are a lot of muscles that come around. Anteriorly comes the quadriceps muscles, then the posteriorly is the hamstring, and there are multiple ligaments and the patella and all. Everything we will discuss later. So there is an important thing that we have to know is the bursa. So what are the bursas around? The suprapatellar bursa. It is called suprapatellar. Patella is here, above the patella is the bursa, which is between in the bone, that is the femur, and the muscle that is coming around, is that is the quadriceps, or the tendon that is here. So suprapatellar bursa, and all bursas, remember, is uh, has synovial fluid around it. So if a patient comes to you with swelling of the knee, and there is synovitis or features of synovitis is around there, so there is always it is always better to put the needle around here, and then you can aspirate. So suprapatellar bursa becomes important, also called the, if there is a inflammation of this bursa, it is called the uh, maid's thing. And around the patella there is a pre-patellar bursa. It is between the skin and the patella, that is called the pre-patellar bursa. And then there is a membranosus, that is between the semi-membranous and the skin, called the semi-membranous bursa, is around there. Then the infrapatellar bursa. Always remember one thing, that infrapatellar bursa has two components. One is the between the tibia and the patellar tendon, and another is between the tendon and the skin. So there are two infrapatellar components of the infrapatellar bursas. Then pes and serine bursa is on the tibia, when this tendon joints at the tibia. So it is also, there is it is called the there is, if infrapatellar bursa is inflamed because of one reason or the other, it is also called clergyman. Wait. So if infrapatellar bursa, this area is involved, it is mainly also called the clergyman's knee. And it is called because this is the area where the clergyman put the pressure while sitting on the knee. So ligaments, what are the common ligaments around of the knee? Is the anterior cruciate ligament, posterior cruciate ligament, medial cruciate ligament, medial meniscus, and the lateral meniscus. Now these ligaments are important because, see, the anterior cruciate ligament, it is called anterior. Always remember, this is anterior, and crucifixion or cross, anterior cross ligament you can call it, or anterior cruciate ligament. It is anterior because it is attached to the anterior of the anterior to the tibia. So that is why it is called anterior cruciate ligament. If something is attached anterior to the tibia, oh, wait. So if it is here, sorry, anterior to the tibia, so it will help prevent the tibia from going anteriorly. So it will pull the tibia backside. So if there is tear in the anterior cruciate ligament, what happens? That tibia, this restriction of the tibia from moving forward will get affected. So if this gets affected, what happens is that tibia will automatically move forward, and this is the test to check for the ACL tear called anterior drawer test. In anterior drawer test, what happens? The knee is flexed, and T1 examiner tries to pull the tibia forward. So if it moves, if there is movement of the tibia forward, that is a sign of anterior cruciate ligament. Posterior cruciate ligament, again it is attached to the posterior side of the tibia, so it prevents the posterior movement of the tibia. So posterior drawer test, again it is based on it. When the knee is flexed and someone tries to push the tibia back, and if there is a significant movement, then that is considered as a positive test or the PCL tear. Now medial cruciate ligament and the lateral cruciate ligament are important for stabilizing the knee and the femur and the tibia. One important thing is that if you see these three things, ACL, medial meniscus, and medial cruciate ligament, these are nearby each other and very closely attached to each other. In many times, what happens, if there is any injury in one of them, all three are involved. If all three, ACL, MCL, and medial meniscus is involved, it is called unhappy triad. And medial collateral ligament and medial meniscus, these are the two ligaments that are very closely attached to each other. So if there is a medial collateral ligament tear, there is always a chance that there will be tear in the medial meniscus. But it is not the same with the lateral cruciate ligament and the lateral meniscus. Remember this. Can you see the gap? There is no direct joining between them. So remember these things, that MCL, MM, and ACL, medial meniscus, if all three are involved, then unhappy triad. Otherwise, if MCL tear is there, there is always a chance of a medial meniscus tear, which is best checked through the MRI. So what are the muscles involved? Muscles are the rectus femoris, vastus intermedius, which is beneath the rectus femoris, vastus lateralis, because it is attached to the lateral side, and vastus medialis attachment on the medial side. And if you go to the posterior side or back side, there is biceps femoris, semimembranosus, semitendinosus, popliteal fossa. As I already told you, this is the site for the artery and vein and nerves all around, and the medial gastrocnemius comes and attaches here, and lateral gastrocnemius. And in between these two, this is the site where the Baker's cyst is formed. And again, always remember, Baker's cyst also consists of synovial fluid, which gets thickened in due course of time. So one important thing is the if you see the medial and the lateral side, medial side, it is the VMO, vastus medialis obliquus. So medial, why it is important, that medial side, always remember that VMO, this is the first muscle to get involved in the, if there is decrease in the gap because of any reason, decrease in the medial gap, if there is loss, then this is the area where you will get the tenderness. Tender, if VMO is there, most common, if you press at this point in the VMO, you will have a tenderness. Patient will say, yes, pain is here and it is significant, common in osteoarthritis. And if on the lateral side there is the iliotibial band. And what is the function of iliotibial band? Best way to remember is peeing like a dog. So the way what it helps in the abduction. So if someone, as the dog is peeing, if you see, they raise their legs. So iliotibial band, it is very easy to remember. Its function is peeing like a dog. So that is the main function, and it is between the gluteus and TFL, and that joins the tibial tubercle. So if there is tenderness at this point, there is and if there is difficulty in abduction, then there is always a chance that iliotibial band is inflamed or injured because of one reason or the other. And important thing is of this knee again comes the nerve and the artery. What are the nerves involved around the knee? It is the genicular nerve. What is the origin of the genicular nerve? Uh, it is from the femoral nerves and the common peroneal nerve in the lower side. That leads to the formation of the genicular nerve around. Why genicular nerves are important? Because that is an important nerve or that you need to know if you are planning for any nerve block around the knee to for pain relief, or patients with osteoarthritis or the any genicular artery. So if you know the nerve around it, then only it is possible. So if you are doing an ultrasound, genicular nerve, you can trace it along the femur or any prominent bone, and then wherever you see the artery pulsating, and around that artery will be the nerve plexus nerve present around. So that is a good landmark to understand about the genicular nerve block. So genicular nerve block again is an important part, but one important thing is whenever we are doing genicular nerve block, we do it in the superolateral, superomedial, then inferomedial, but we avoid this side. We avoid uh, this side because common peroneal is all around. Always remember that common peroneal or the fibular nerve is around here. This is the head of the fibula. So from here, this is the neck. That is a very important part that one has to keep in mind while doing the genicular nerve block. Not only the genicular nerve block, also while doing the casting of in the leg. If you are doing a casting in the ankle, around the ankle, then you have to make sure that this area is not involved. If there is compression around this, after 2 to 3 weeks, patient will come to you and he will say now he cannot lift his leg and he is unable to walk and there is paralysis all around. So common foot drop symptoms will be there. So keep this thing in mind that this is the area which we have to save. This neck has to be saved. It can be palpated and while casting, while doing the nerve block. Okay. Okay. So these are um, the most important thing. Now, what are the problems that we face in day-to-day OPD, and those problems that cannot be neglected. As I already told you, osteoarthritis of knee, the medial joint space is decreased. If medial joint space is decreased, then there is involvement of the VMO, and if VMO is there, there will be inflammation and tenderness. If you palpate the VMO, then there will be problem. Cruciate ligament, anterior cruciate ligament, and the posterior cruciate ligament. Cruciate ligament injury is common. Anterior cruciate is there. Remember this anterior cruciate, anterior side of the tibia. If someone goes and hits a person from the back or from the posterior side, then there is always a chance because of the hyperextension that can lead to the injury. But opposite applies in the PCL tear. In the PCL tear, what happens if this is also called dashboard injury is a common cause of it. What happens in this PCL tear is that posterior side there will be there, and all of a sudden knees goes into hyperextension because of the injury flexed knee. So that also leads to the uh, injury of the PCL. And again, As I told you guys, that there is always a chance that uh, posterior drawer test will be there. So bursitis, housemaid knee, if there is a pre-patellar bursa involvement, and clergyman if there is intra-patellar bursa involvement is there. So this is all.